Hello and welcome to another episode of the Aligned and Elevated podcast. I'm your host, Dr. Allison Feldt, owner of Body Motion Physical Therapy, owner of AF Wellness Community and Coaching, and mom of 3, lover of this podcast, author of 2 books, Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age, and Pregnancy Era, all about having a push-free birth, tear-free birth, in just living your best pregnancy life so that you can recover fast postpartum. Really, that's what all that book's about. So you can always get my books online. They're on Amazon, and we also have an online birth prep program, and that is a great way to train for your pregnancy. But I digress. Okay, so this podcast, we are going all in on back pain and SI joint pain. So if you've ever had back pain or low back or SI joint pain, and maybe you feel like you throw your back out a couple times a year, maybe once a quarter, maybe every other month, and you just don't trust yourself. Like you're like, you could cough and throw your back out, you could bend over and throw your back out, or maybe you shaved your legs and you threw your back out. That's what I'm talking about today, okay? Because I've been going through this. I injured my back in February, and now I've retweaked it one time, and the initial injury was like 2 years ago in July, and so it's a nightmare. Every time I hurt my back, it's like I have to go through this whole series of PT and pelvic floor therapy. And now I, thank goodness, have all these regenerative tools like shockwave therapy, EMTT, and red light therapy that are helping me manage the discomfort. I also use dry needling. I use chiropractic care. I go to Edmund's Family Chiropractor. And these are all the things that I throw at myself when I throw out my back, quote unquote, throw out my back. So there's a million reasons why people can keep retweaking their back. And that's where working with an expert who can really look at your whole body, including your pelvis, is absolutely essential. Because if I was just going to a standard PT, we wouldn't be getting to the root cause of this. Now, granted, yes, I've re-injured myself. I push my body extremely hard. I play hockey. I train really hard, lifting 4 or 5 days a week. I do cardio 5 days a week. I mean, I push it. I know that. I push the limits, and then I expect performance out of my body, and sometimes I run it down. And even though I do everything I can to rest and recover, there is this level of give and take. And so I have re-injured myself, and I went through a little bit of a phase where it's like, I honestly felt like a fraud. Who am I? I help people with this back pain that I'm experiencing, yet I can't freaking cure myself. And the thing is, I have all the tools in the world, and I still have to work really hard to undo my patterns. So you might be like, well, what's a pattern? A pattern is maybe you had an injury. Maybe you had a childbirth that left scar tissue or left abnormal movement. So for me, before I even had my 3 children, I had a left knee surgery. So I had a left meniscectomy surgery, and even though I did physical therapy, I just have never gotten back the full joint proprioception. They scraped the nerves off the joint, and I just haven't gotten back full proprioception. So my left leg just doesn't move as normal as my right leg. It is impaired. I try to work through it, and all my training is accumulated on creating balance and symmetry on my pelvis so that there's equal forces when I'm doing exercise or when I'm playing sports, so that there's equal forces through my SI joints, equal forces through my spine, so that my joints are absorbing my core is absorbing the forces and not my joints. So I'm not going to wear my joints out. That's my goal. That's what I train for. That's why when I see my pelvic floor physical therapist here at Body Motion, when I see them, they're constantly like, okay, Allison, this glute is under firing. My right glute's under firing. My right hamstring's taking over for that glute. The right psoas is taking over. So before you train, you need to do some activation work on that right glute. And it also might mean that I need to get my pelvic floor released. I need to get that hamstring released in order to be able to recruit that right glute. And so there's just work and awareness that goes into making sure that you're keeping your body balanced. So I ended up doing a physical therapy evaluation for somebody yesterday, and she was, I think, 9 years older than me and complete mirror of myself. Granted, she had C-sections and she's had some scar mobility work done, and her scar actually moved really well. And she was just like a mirror image of me, and like shared my exact pattern with like left knee surgery. So there's a lot of patients I see that have had previous knee surgeries that then they have opposite sided hip pain or opposite sided SI joint pain. So they might have had a right knee surgery, and then now all of a sudden their left SI joint or their left hip is now giving them trouble. And a lot of times that has to do with, okay, we're not getting fully into our joints because we're not moving on a joint level. So the joints move, they glide, they slide, and they roll. And a lot of times post-operatively, we don't get that back. Those are called arthrokinematics. It's how the joints move. And if we don't get that back post-operatively, or we're blocked by scar tissue, or we're blocked by just not utilizing the movement because we never gained the strength back to gain the movement back of the joint, then we end up with dysfunction, and then the body compensates. So anytime there is that injury, the body will find a way to move around it and activate around that. And you can really go your entire life, or go 5, 10 years, 20 years, compensating around that until all of a sudden the body gives out and can't do it anymore, and or starts to wear out a different joint or a different problem. Well, for a ton of women, especially if they've had previous knee surgeries or even ankle surgeries, usually it's the opposite side that gives them havoc in their pelvis and or their low back. And then a lot of times it goes even higher up into the low back, and maybe it's at the lumbar thoracic region. And for me, that's where a lot of these problems are. And they're hard to treat because it's not like you can just treat my lumbar spine and then everything is good, or you can't just treat my pelvis and everything is good. We have to treat the entirety of me in order to get me out of pain and get me back to training. And that's exactly what we have to do for our clients too. So I was so passionate after I saw this patient yesterday, because I was like, you are me, I am you, we are one in the same. And is that not the case for everybody? Yes, that is what we are. We are all connected, right, on a soul spiritual level, I believe. And so that makes me just want to help everyone. I have a really hard time keeping myself in check, especially if you tell me about some pain you're having, or you tell me about a previous surgery you have. Like, I will probably invite you into the clinic. It's really hard for me with like the guys on my hockey team not to be like, I can fix that, just come in, or like, our shockwave, like just shockwave that or EMTT that and it'll dissolve for you. Like, it's so hard for me to keep myself in check, because we can, you don't have to suffer. Like, if you choose suffering, like, you're wearing something else out in your body, right? So anyways, it's hard for me to keep myself in check and not just invite everyone to come into the clinic. And I often forget, because we have a women's health physical therapy clinic and it's all women here. Like, when I want to like fix a dude on the team or fix a guy at the gym, like, I have to be really cautious that I'm not like I know I don't want to put that on my team. But it's a funny challenge, because I'm like, I need to fix this person. I need to do this, and I don't necessarily have the time to do that. And so, but it's funny. Like, I laugh at myself, because I'm like, I was put on this planet, I guess, to help people fix their bodies so they can live their best lives and unlock their creativity, which will then unlock their potential so that they can live really good lives, right? Anyways, total digression here. But what I want to get across is that these patterns that can happen in the body will end up wreaking havoc on other parts of the body. And that's why it's so essential to get back to fixing the cause of what's going on in the first place. So for a lot of these women, they might have that knee surgery, and then they might have multiple pregnancies stacked on top of that. If they're a C-section, if they're cut, with that C-section scar, you have to melt that scar and get the lower abdomen and the core to really start working again. Most people don't go through that process after a C-section. And even if they did, they might not have had all the work needed. They might not have had the pelvic floor work. If you have a C-section, you still need the pelvic floor work in order to get that pelvic floor opening. And for us to get that pelvic floor opening, that takes not just breathing and exercise. Like, you need manual manipulation to change that tissue, because after you have a C-section and the scar in your belly is tight, it pulls up on the pelvic floor. So it's really important that we open up the pelvic floor and improve the fascial extensibility, improve the muscular extensibility, and also do manipulation to melt the scar tissue on the belly, do some radial pressure shockwave to really release that scar and completely melt it, so that that scar isn't allowing you to have restrictions in your deepest of cores. And then once we get that melted, then we can retrain everything, and that will be protective, so you're not creating more compensations. The issue is, like, a lot of these women that had C-sections, I mean, even currently, but 10, 15, 20 years ago, still, they didn't get the scar melting. They didn't get the core retraining. And so they're sitting here not using their deep core, and then they're wearing out other joints, right? Their hip is taking the toll. They're wearing out their SI joints. They're wearing out their knees. Everything is a little achy. They can't trust their movement. They might be continually throwing their back out. If they're continually throwing their back out, a lot of times there's like some kind of twist going on. Maybe it's like the right side of the scar is pulling more on the spine, and that's creating a little bit more pressure through one side of the spine, putting more torque on different discs and different nerve roots, which is causing disc herniations or chronic sciatica. So there's a lot that goes into everybody's patterns, you know, and I think in life, everyone's going to have these patterns. You could have sprained an ankle as a child, and maybe that was the one thing that, like, you never walked the same again. Hopefully that's not the case, but that is very real. That can happen. You can have an injury and it just not fully come back. And so other parts of the body start to wear out and just wreak a little bit more havoc on your system. And if we don't unravel and unconnect these patterns and then retrain the body and the nervous system to establish new functional patterns, or at least work into those patterns, then we are going to be constantly chasing pain. And now you can either constantly chase pain or constantly changing your patterns. And you know, it takes a ton of work. I've been trying to change my knee pattern since I had the knee surgery in 2009, top on some pregnancies, a little bit of poor training habits, you know, and there's a lot of work to do. And I like to play really hard on my body, right? Like playing hockey, I don't go easy. And so, you know, it's a give and take, but it's making sure that what you're doing from a recovery perspective and a training perspective is creating balance. And a lot of times it's like people don't even know where to start. And that's where starting with a pelvic floor physical therapist is so essential. So we can map every single pattern in the body. And at Body Motion, like, that's what we're really good at. If you've had previous C-sections, a knee surgery, an ankle surgery, a plantar fasciitis, we will map that through your body and help you correct your patterns, from how you're walking to the certain exercises you need to do to correct your posture or to correct your, your right glute firing versus your left glute firing versus your psoas or your hip flexors taking over all your movement, because your TA doesn't work, your lower transverse abdominis doesn't work, so your hip flexors are doing all the work. So you have this chronic hip flexor tightness, and if you have that, then your glutes can't work. If you have that, then your pelvic floor can't work. So that's where you get this chronic dysfunction. This is why every single woman honestly just needs a pelvic floor physical therapist, because you think about pelvic floor physical therapists in regards to needing someone, I pee my pants, I need help with that. I had a baby, I have scar tissue, I need help with that. I like yes, and yes to all those things, or I can't orgasm, or I don't have pain-free sex, or like sex doesn't feel good, I grit my teeth through it. So like, yes, pelvic floor physical therapy for all of that. And also, if you just have chronic hip tightness, if you have been in and out of PT offices, acupuncture offices because your back is hurting or going out, like, yes, pelvic floor physical therapy. Now, it takes a long time to change patterns. If you think you're just going to see a PT for 6 to 8 weeks and be cured, like, okay, sure, your pain will go away in that time, but like, you're not changing patterns that have been going on for 20 years in that amount of time. That takes work. And like, that's where like the health industry, like healthcare, isn't really set up for that change, right? That's why it's like, okay, at least get out of pain, and then let's set you up for your joint replacement, and then that joint replacement will just cause more problems and compensations in your body, but then you can replace the hip in 10 years, right? And that's why we have like these joint replacements and the lumbar fusions or lumbar discectomies. I'm not saying they don't have their place. I'm just saying that if we went all in on prevention and getting to the root cause of unwinding the system and changing the patterns, we would have a lot less surgeries. Would we eradicate all of them? No. Like, you're gonna have traumatic injuries that create acute arthritis that you're not gonna be able to get rid of for the rest of your life. But if we can change your patterns and get you as strong as possible, we'll help prevent that surgery, or at least freaking delay it. And at least get you like really functional in your life. And what I hate hearing is that like women just bog down in pain, cranky as all get out, don't have the luster for life that they did because they don't even know if they can bend over and tie their shoes or unload the dishwasher or fold the laundry, and every single task becomes a weight, a heavy weight that you just don't know if you can execute. And that to me is super sad, and also I feel it 100% because after going through my last bout of low back pain, I just was super pissed. I was super annoyed. I snapped at my husband, I snapped at my children. I wanted, like, I didn't want anyone around me. Like, I was negative and angry, and that's not an excuse to be negative and angry. Like, I believe in like always trying to be your best self, and I wasn't my best self. And so, you know, I have to forgive myself for that, right? And also realize that like it is my personal responsibility to keep my body as healthy as humanly possible so I can show up not just for myself, but for my children, for the people that work for me, for the people that I meet at the grocery store. So I'm not a cranky old lady or young lady or however the hell you want to classify me. And so I just think it's really important that we normalize everyone getting pelvic floor work. If you have low back pain though and SI pain, like this is a non-negotiable. If you have not had internal pelvic floor physical therapy and someone really get through your abdomen and find your restrictions and figure out your patterns, then you haven't had real pelvic floor physical therapy. That's what this is all about. And, you know, I hate to make this like you know, you need this for the rest of your life situation, but like at the end of the day, I believe that everybody needs to continue to keep their bodies tuned up. And if we don't, we are going to revert back to different patterns and different you know, ways in which our bodies move instead of correcting those patterns, unwinding those patterns, and improving the movement of our bodies. So I'm leaving you with that today, and I hope this message hit for somebody out there, because my heart yesterday after this evaluation like was just heavy in the fact that I was like sad that this woman had been going through like years and years of pain, and no one had really looked at her pelvic floor, even though she had been to pelvic floor physical therapy before, but that therapist just didn't think it was her pelvic floor. But I hit some things in her pelvic floor, just touched them, and she's like, that's my pain. That's where I feel like I can't even move my hip. That's what I've been trying to stretch for years. And it's like, okay, I'm sorry you had to experience this. She's like, and she can't really tell if it's her hips or her back. Like, she doesn't know really what's the pain is coming from. And I was able to see it in less than an hour. We came up with a plan to get her better. Now, is this going to be a 6 months to a year commitment of like working through and breaking and unwinding this pattern? Yeah, I'm working against 20 years, but she's premenopausal and we have estrogen and progesterone on our side. So that's really beneficial. And even if we didn't, it might take a little bit longer, but there's a lot of things nowadays that we can do to help improve tissue health and accelerate healing as well. So, and a lot of that is our regenerative technologies. So I hope this message hits for you, but if you know anyone with low back pain or chronic SI joint pain and they're like continuing to throw their back out, please send them this video and just let them know that there's hope. There is hope. Getting someone to really read the patterns, see what's going on inside the pelvis, outside the pelvis, in the low back, in the feet, in the knees. We're looking at all of it. It's all connected. All your previous injuries are in your body, and we have to not ignore that. And we have to make sure that we are working to continually to improve and create balance across the pelvis, across the low back, across the thoracic spine. And the more we do this, the more that we are going to be little old ladies that can stand up straight, go to their exercise classes, live at their homes independently, and we are going to avoid those nursing homes and the diapers and the wheelchairs. So I'm Dr. Allison Feldt. I hope this message hits for you today. Please like and subscribe and share with your friends. I hope you have a lovely day.